2.5 million in the last week, and ministers saying that they're on course for their target by the middle of February for the 4 priority groups.
And Hugh, it seems that this will be the week that we're past that awful figure of 100,000 deaths in the UK. I mean, you've been covering this for an awfully long time, right back to the start of it. I wondered, can you even sort of get your head around that figure, bearing in mind what we were thinking about back in February and March of 2020?
No, it's hard to get your head around a figure of 100,000 deaths. 1,000 deaths would be a good outcome, and at that time 20,000 seemed like a lot, and very and the highest of leading European countries. So it's going to be very, very difficult. It does take a little bit of just getting your head around just at how things are going at a hospital like Kingsmill in Mansfield and other intensive care units is the NHS and doctors and nurses are getting better at treating people in hospital. There are drugs now, there are figure and quite something when that figure is reached.
Hugh, thank you very much for your time this morning. Good to talk to you. That's Hugh Pym.
And let's continue talking about that thought, actually. And as the UK approaches the heartbreaking total of 100,000 deaths since the start of the pandemic, the impact of COVID-19 continues to be felt by the families of the victims and also, of course, those who help support them as they prepare to say goodbye.
For funeral directors, it's been an exhausting and emotional 12 months, as Tim Muffet has been finding out.
West Malling in Kent, and an extra delivery of coffins to keep up with demand.
Normally we'd have a larger sort of 20, maybe 30 empty coffins being delivered here, but because of the levels that we've seen, we've had to have more frequent deliveries. I've been in the profession for over 20 years now and I've never experienced anything like this before.
Viner & Sons was established in 1777. Right now it's conducting twice as many funerals as normal for this time of year.
COVID cases, I would say we're around 80% of the deceased that we're dealing with. It's been a struggle for us. Obviously, you know, we're dealing with bereaved families in general anyway, and when you're under such circumstances as COVID, it just heightens everything. It heightens emotions, and you know, as much as we're here to deal with that, obviously, you know, we can't help but get involved with families' emotions as well.
Vinters Park Crematorium in Maidstone, and the funeral of 86-year-old Beryl Hook.
My mum was a lovely lady. Well, she gave birth to me and brought me up, and I could not fault her. She was very generous, very caring. What else can I say, really? She was my mum, and already I'm missing her. Unfortunately, she contracted COVID in hospital, and sadly, within a week, she passed away.
It's extremely frustrating because we couldn't go and see her when she was conscious still in the hospital, and you know, we've come here today and it still doesn't feel like you've had a proper closure because there was no contact from her going into hospital to the death to the funeral.
Before we could do sort of 5 or 6 a week, we're now sort of over that, 12 to 15 a week.
How draining is that for you and your colleagues?
Emotionally, very draining, you know, when we have to deal with the families that are coming into us, but physically as well. You know, it's a very manual job, it's a very hands-on job. This sort of profession has been very taboo for many, many years, but I think that it's quite sad, but something like this has had to bring it to the forefront.
Of course, a lot of friends and family members aren't allowed to attend funerals at the moment, so many of them are looking for other ways to remember loved ones. Charlotte is helping the business provide people with other ways to grieve.
At the moment it's particularly crucial because a lot of people aren't attending a funeral and can't say goodbye to their loved ones. So we're finding that there's a real issue entering the grief process. So we have jewellery here, for example, that can house the ashes of your loved one. We also work closely with a company that turns ashes into diamonds. It is a real diamond. It's made from the carbon from ashes.
Hi Tracy, how are you?
Meanwhile, arrangements for another funeral are underway.
There is families that haven't seen their loved ones. They've been in care homes, they've been in hospitals, and you know, we're just doing our best and what we can to look after them.
Yeah, I think exactly that. I mean, it's just very sad that when you have to tell people that no, they can't actually have all the people they want to attend a service, and no, sorry, you can't actually carry your loved one in. Strangers are carrying them.
With every death comes the need for another funeral. For companies like this, these are busy but emotionally draining times. Tim Muffet, BBC News, Kent.
It's 8:25. You are watching BBC Breakfast.
We know there's some pretty grim news around at the moment, but also
The weather wherever you are.
Good morning from BBC London and BBC South East today.
Figures generally some milder air coming through with this weather front. Now overnight tonight that rain day.
That's it from me for now. I'll be back in half an hour. Have a very good morning. Bye-bye.
good morning. You're watching Breakfast with Louise and Dan this morning.
And Morning Live is back for a new series. It's on BBC One straight after breakfast. And get
several tips if you're struggling with your dogs at home.
Yeah, excellent stuff. OK, lower body workout this morning. We'll see.
This is a very good idea.
The dog or the socks?
No, definitely the socks. Definitely the socks.
Right. Thank you. Look at that. Your
of course.
question.
I mean, you know, that is obviously what you should be doing with your socks.
Yes.
Anyway.
Don't leave them out.
Thank you.
It's 8:32. We've been speaking this morning about...
Kevin sent us a message simply entitled Bad Haircut. There you go. Not much you can do with that, really, is there, Kevin? Sorry.
Lucy's daughter, Amelia, is half happy.
Did you leave it there, Martin, I wonder? You send it out later.
That's a parental cut.
Anyway, I mean, how long are we going to have to go and what are we going to do? If you want to look like you've had a professional cut, don't follow Dan's tip. Follow tips from professionals. We can speak now to Hannah and Jackie Remington from Eye Candy Salon. Thank you. We support you.
Thank you, Hannah, as well. Good to talk to you all.
Now, a pair of tight pants out for them. They say, oh, that's terrible for fertility. That'll be constricting. But they're all wearing them. Or something like them, you know, tight. You go, and so I think we know these things. Much that can affect you. I think most of us would assume that it's in the margins. It might make a little difference.
Well, listen, it's absolutely fascinating. I know you will have opened up the conversation for lots of people, and I'm sure they'll be really grateful for that. Rod, thank you so much. Thank you.
And Rod Gilbert's Stand Up to Infertility is on BBC Two. It's on Sunday at 9:45, and of course, as you would expect, it will also be available on the iPlayer.
And as ever, he's really funny too, in it.
Oh, he deals with it in a
humorous...
Just the perfect sort of lightness of touch, but serious when he needs to be. It's brilliant.
Excellent. Are you watching BBC Breakfast, 8:59?